You are watching 2+U Nevada. Joining us this afternoon, Dr. Chad Kingsley, the District Health Officer for Northern Nevada Public Health, to discuss something that is so important. We're seeing it all over the news, but really and truly, it's a discussion in the community, how bad the flu is this year.
Yeah, right. We're seeing a lot of people saying, you hear a lot of anecdotal information that, man, I got the flu. I've been laid up for 2 weeks. We're seeing a lot of those cases, and we've seen we're seeing that within our hospitals as well, too.
You know, social media, thank goodness. My husband and I were like, oh my gosh, thank goodness that we were out of town for the last 2 weeks, because it seems like it hit right around Washoe County's school break, like winter break, and everybody getting together for Christmas.
We did, and we always, in public health, we always look at that school break as kind of a reset. But over the last 2.5 weeks, we've seen our flu cases skyrocket.
So is it that people are catching it at school and then bringing it home, or just the time of the year?
I think we're seeing some of it's that. So it's just bringing it a little bit from home, but also we've seen a more, it's been in the news, the H3 variant, which is a lot more aggressive. So also, right, we also had Christmas, we have our holidays where we gather. So we're seeing a lot more cases of just cross-infections, so.
And you mentioned the H3 variant. So if you get the flu shot, what is that based off of? Was it Australia's flu season? Like, is that how they kind of determine which flu strain they're going to inoculate us for?
Definitely, yeah. So they take it across the world. They see where the most common variant is. So this year, while the flu vaccine is not targeted specifically for H3, just because it's not perfect doesn't mean it's not effective. So when you do get the flu vaccine, it does help boost your immunity across, overall, and strengthen it. So you either will see no symptoms, or if you do get symptoms, you'll see less severe symptoms. Instead of 2 weeks, you might only see a few days and minor symptoms. So it still helps.
That's what we want, right?
That's what we want.
We want more minor symptoms, because does that mean you're less likely to be hospitalized?
It definitely. So right now, 10% of all our cases in emergency rooms and urgent care are flu. So we don't want to overburden or tax our healthcare system. So definitely any type of immunity that we can help provide to lessen that for healthcare providers is beneficial.
And I'd be remiss if I didn't say already, Washoe County has seen, unfortunately, its first death, a 65-year-old man who did not have the flu shot.
Correct.
And so, again, the flu shot may not prevent you from getting the flu, but it may lessen its severity. Is that accurate to say?
Yeah, it's right on. And so definitely in our pod 2 populations that are most susceptible are our youngest and our oldest. So with our adults, a lot of times they have comorbidities. So they might have diabetes, they might have blood pressure. So their immune systems are weakened. And so to get that immunity, that additional immunity to help prevent, to lower the symptoms is beneficial. And looking at our past years as well, we see that our deaths last year, the majority were unvaccinated. They were adults, but we did have a few youth that did die last year.
And that is so sad. And I think I saw in national news this morning that we have already seen a very high number of pediatric deaths due to this year's flu.
Yeah, it's not as high as the H1N1 scare that we had that a decade ago, but it is rising significantly, that we are alarmed.
So if somebody in their house has already had the flu, could they still get the flu shot and have it help them throughout the rest of this summer?
Yeah, definitely. So we are offering a free clinic today. So I know we'll be announcing it, but we're always available at the health district that you can schedule an appointment. If it's cost prohibitive, we can find a way to pay for it to cover those expenses. We just want to make sure our community is safe economically as well, because if not, you being out of work for 2 weeks or your children out of school for 2 weeks is a big impact on your families.
Absolutely. It tears you down. We got the flu in our household in February. I told you this. Yeah. And my kids and I were down the entire month of February 2025 is non-existent.
Yeah.
Because the three of us got the flu and it went from one to the other to the other. So again, I do want to say that if a child has had the flu, we should still get them vaccinated. If an adult has had the flu, we should still get them vaccinated.
Yeah, it helps them. Even unvaccinated, it's not too late, but if you've had the flu, still getting the vaccine will boost your immune system, because you might have previously had a different variant, and if the H3 exposed to it, you could possibly be reinfected. So getting a flu vaccine is beneficial at this time.
Okay, and what I found so interesting in taking a look at your infographic that you have on social media, I didn't know that the flu season runs until May 23rd.
Yeah.
So we're considered flu season all the way into essentially the end of school.
Yeah, we do, because there's that higher rate of exposure between kids. We can see spikes even into April, into May. Again, we have spring break, those different times that people are traveling and they could go somewhere and get exposed to a variant there and come back. So we're always watching until May.
Okay, and then also we've been mainly discussing the flu. I'd be remiss if I didn't ask you, how are we in Washoe County with the COVID situation and RSV? Both of those very important to discuss.
Yeah, so many times we started to call these ILIs, so influenza-like illness, but RSV and COVID. We are seeing a rise, but similar to previous years, so it's not a spike that like we're seeing in influenza.
Okay, this show is from 3 to 4 in the afternoon, but you have a free vaccine clinic is it for flu, COVID, and RSV, or flu and COVID?
Definitely flu and COVID. If somebody needs RSV, we can see what we can do to be able to provide that.
Okay.
So, but definitely flu and COVID are free until 6:30 today.
Until what time again?
6:30.
6:30 today. And then, of course, if you can't make it today, Northern Nevada Public Health, always an avenue for you to get a vaccine, and you can help people figure out how to pay.
Yep.
Thank you so much for joining us this
Happy
afternoon.
to be here.
Such an important discussion.
Yeah. Thanks.
All right. You're watching 2 Plus U Nevada.